This is a breaking news alert from 24-Hour News 8.
We have breaking news right off the top today at noon. 3 flu-related deaths in Kent County. This just came down a little more than an hour ago. These are the first known flu-related deaths in West Michigan. Good afternoon, everyone. I'm Susan Shaw. Let's get straight to 24-Hour News 8's Danny Carlson. She's live at the Kent County Health Department tonight with the details. Danny, what are you finding out?
Well, Sue, we are learning more. I just finished talking with someone from the Kent County Health Department who told us that those people who have died flu-related deaths, each of those 3 people are 50 years of age or older. We do know that 2 of them had an underlying medical condition. We're not yet sure about the third. We asked about their exact ages and exact medical conditions, and we were told those could not be disclosed due to health privacy reasons. Now, these 3 deaths are more than we had at the same time last year for flu-related deaths. The health department has told us that each of the 3 who have died in Kent County had the H1N1 strain of the virus. This year, that virus tends to affect people between the ages of 20 and 50. Those people are usually not as susceptible to the flu. Tends to affect them more than other flu viruses have. Earlier this week on the other side of the state, we know that 3 people in their 20s with H1N1 died. So we wanted to know today, since this virus does seem to affect such different age groups just across the spectrum, should people here in West Michigan be afraid of the flu?
People should be taking it very seriously. We don't want people to be fearful to go out and continue doing the things they typically do. People die from influenza every year. We do know, though, that this year the H1N1 is causing severe respiratory issues in somewhat healthy individuals and in populations that we typically haven't seen get hit so hard.
And of course, today, the best protection for you and your family to from catching the flu is to make sure that you get a flu vaccine. We were told today part of the reason that H1N1 is affecting those groups between 20 and 50 more than other viruses have in the past may be because those are the people who aren't usually the ones who actually go out and get a flu vaccine. Now, the health department here says they do have enough vaccine for people who want to get vaccinated. You can go to stickittotheflu.com, make an appointment, get a vaccine. They say it's not too late in the season to get a vaccine, and they say that it is particularly important to get a flu vaccine if you're helping infants, if you're working around infants, or if you yourself do have an underlying medical condition. Now, we'll continue to work on this developing story and have more for you at 24-Hour News 8 at 5 and 6. Live in Grand Rapids, Danny Carlson, 24-Hour News 8.
All right, Danny, thank you very much. Our team coverage on this continues this noon with Coco McAvoy, who has a look at the flu outbreak by the numbers, and she joins us live from Studio Control right now. Coco?
Sue, we've been telling you for the past 2 weeks that this flu season is hitting earlier and harder than in years past. And so far, that assessment is right on target. Here's a look at just how hard the flu is hitting some areas of West Michigan. Kent County has reported 400 cases. 26 of those flu patients had such severe symptoms they had to be hospitalized. Ottawa County tells us they've had 12 confirmed cases of flu between October and now, but dozens of reports of students with flu-like symptoms. We're still working to get data from other counties. There were also several flu-related deaths on the east side of the state over the past week. Health departments and the CDC are pushing vaccines heavily this year. They say everyone over 6 months old should get one. The CDC claims that the vaccine prevented nearly 7 million flu cases and about 80,000 hospitalizations last year alone. They say you need to get the vaccine soon if you want to avoid this strain. Live in Studio Control, I'm Coco McAvoy, 24-Hour News 8.
Okay, Coco, thank you. There are other ways to avoid getting and spreading the flu. It goes from person to person through coughing, sneezing, and even talking. You should always cover your mouth. You should avoid touching your eyes, mouth, and nose because you could pick up flu germs from things like phones and keyboards on your computer. And of course, if you do get sick, stay home from work or school until you are fully recovered. We're calling all of the health departments for you in our area to gauge the flu outbreak in West Michigan right now. We will have those numbers and much more information from doctors on the front lines. We'll have that online at woodtv.com and, of course, on your 24-Hour News 8 at 5 starting later today.